Everybody, Dr. Nelson, I'm back. I'm showing some demonstrations today of me doing my chiropractic system, my bodywork system known as torque reset. Dylan, good to meet you.
You too,
How are you?
Good.
Good. How may I help you today? What are you doing?
So I've been having some TMJ issues a little bit lately. Been grinding my teeth a little bit at night and just kind of feeling a little deviation, chewing and...
Right. So when you bite, it doesn't feel like the alignment of the bite is proper. All right. Once again, I love palpation and I love muscle testing. Do you mind if I palpate your jaw? Make sure you get this up close here. So you relax your jaw. One of the things I'm going to do is I'm going to palpate his jaw. I'm going to push upward like this and see if it springs. Let's here. Let me turn you this way. So we're going to very gently. We're going to see if we do this. If it springs, right? Posterior translation, and it's pretty doggone nice. He's in good shape here. I'm going to turn you this way. We're going to gently deviate the jaw this way. What do you notice?
Not much.
Not much deviation, right? Let's deviate the jaw towards me. Much better, but you feel you even have a little bit of restriction there? Okay, so I'm going to jump in. There are all kinds of things I can do. I, of course, you know what, I'll back up here. I'm going to check the cervical spine to make sure that the innervation of the facial muscles, the jaw muscles, and the neck muscles are all set. And of course, we have proper mechanics, because if you've got an anterior head carry and yours is relatively mild, then that's going to contribute too. So here we go. Watch this. We palpated, we checked for proper motion. I'm going to push down here, and it's a pretty weak arm test. Are you applying yourself here? Yeah, it's pretty weak. Let's try this one. Now hold. Very strong. You agree? So let's see what we have to do to get some of this stronger here. And I'm going to go through this a little quickly because I really want to focus on the TMJ issue. Going down here, let's turn this way here. Going to check the tailbone first. And here we go. Tight. Now, people watching this are going to say those were your knuckles. They can't be my knuckles if I've been working on people for the last hours. Right? Now, let's test again. Hold right here and hold. What do you think of that?
Stronger.
Didn't do anything to directly impact the brachial plexus, the nerves emanating from the neck. We're going to go test it again. Beautiful. Much stronger. SI joints. Oh. L5. Real blowout point. Dylan, may I have you lie face down? So if I can, I'm going to do the facet imbrication mobilization that I spoke about earlier. Going to pinch you. It'll be unpleasant. My apologies in advance. I'm going to come in here. I'm going to start here, top of the sacrum. Gently pull, hold. Boom. Go to L5. Gently pull, hold. Pop. Now, got the joints to cavitate, to release. I'm going to get rid of a little bit of the lumbar tension here. Torque reset here. There we go. So thoracolumbar junction, L1, and a corrected L3 using torque reset. Just going to come up here, make sure he's moving well, and he is. Okay, Dylan, hold on. There we go. Wanted to release some of the fascial adhesions and the paraspinal musculature. Dylan, may I have you stand up, sir, when you're ready? Now, you need a moment? You feel okay?
Good.
Okay. Turn this way here, sir. Now, I'm going to check arm test, make sure it's still strong. Remember I told you, sometimes you can make one correction or two corrections, and you can take 2 steps forward and a step back. Not as strong, okay, but still testable. We're going to go back down, look. Now, we've got another issue. See, not that I did anything incorrectly, but what I did was, here, if I may, Dylan, I released all the tension here. Now he has a major point of contention right above the thoracolumbar junction. So what's happening is there are punctuated points throughout the spine that are locked. There's nothing below this point to brace for all the tension here. Now it is short-circuiting his system and his mechanics. I'm going to turn him this way. Sir, I'm going to grab your wrist here. I'm going to grab your other wrist here. Now, you don't want to put too much force here, or you can crack ribs or dislocate ribs. The real movement is with the chest. Deep breath in, blow it all out. Point his attention. Beautiful. You okay? Make sure you stabilize them. Now walk around. Love to have people walk around because it helps the nervous system reprocess. It also helps the mechanics reset themselves. Very, very important. Dylan, if you would, sir, come right here. Turn around here. Going down to the bottom again, making sure I didn't create a mess down here. Beautiful. Feel strong that is? 3 and 1. I'm going to clear them out in one fell swoop. And I'm going to muscle test here. Look at that difference. So I have to apply my corrective force torsionally and using a long axis extension maneuver, which means this way, and I've got to couple this torque reset motion this way. I'm going to come in here. I'm going to have you I'm going to take my hand here, interlace your fingers, put them over mine, gently drop your head forward and to the left. Now, lean back, squeeze the elbows towards the nose. Oh, not too hard. A little bit. Ready? I skip 2. I set a spiraling force in a long axis method through his upper thoracics, released 3 and 1. It was pretty cool, by the way, wasn't it? Yeah. Now hold. Good. But look at his neck. Look at this. Neck is smoked. I can't help him with a TMJ problem, particularly if the apex of the curve, C4, C5, even C3, those areas aren't really clear, and his atlas and axis. And I know it's most of the segments, but I'm speaking as a collection. So the segments that really approximate the wear and tear at the apex of the curve, which is usually C4, C5. And then I want to make sure that the motion, right, most of the rotation occurs at C2. I want to make sure that's all adequate. So we're looking at those as segmental clusters. And C4 is really stuck here in extension. Let's have you lie face down. Once again, I don't have to use drop, but I have a drop table here, so I'm going to use it, and we're going to use a torque release, or torque reset, excuse me. Torque reset, the first name of my system used to be torque reset, and then after I've been doing it for 10 or 15 years, I understand there's another chiropractor who used that. So we'll go back to the torque reset. We're going to come in here, and Dylan, I'm going to part your hair. Here's 4. So watch hopefully you can see my thumbs. His spinous process is over here. So we're going to go down and rotate. So we're going to go down and rotate. Here we go. Very, very different than a standard drop. So we're still using that torque reset application. So my corrective motion was to go down and up and torque counterclockwise. Again, to go down, can you get my hands here? To go down and up and torque. Now let's have you walk. How you feeling?
Good.
Okay. Dylan, come right back here, sir. Let's test his arm here and hold real hard. Beautiful. Let's do this one and hold. Do them together and hold. Okay. Still a little weaker than I'd like. Let's get a little clever here. Let's have you bite down, Dylan, okay? Not too hard, but bite down enough to stress the joints and look at how weak he gets. Look at that. Now we're going to localize. Okay, here. This side here. So spine is rotated left. Now relax. Come right around here. So I'm going to see if I can do this. This is a torque reset move here. I'm going to come in here like this. There it is. Good. Give that just a second. Now bite down again and hold. Beautiful. Feel that difference? We'll quickly scan. Now bite down. Now let's see where we need to correct. Hold. Weak on this side, big time, making them worse. Going here, turn this way here. Gonna go on the TMJ here, right side. Boom. Strong as a rock. Now let's check vector of correction. Do we need to go straight in No. Do we need to come down, ramus? Yes. Let's have you lie right on your back, sir. Now, thank you, Dylan. Here's how we do this. I'm going to say to you, ready. You can nod your head, you can say ready. You and I are going to get into rhythm. I'm going to say, while my hand is applied to the side of your face on the ramus of the jaw, I'm going to say ready. Yes. 1, 2, 3, now. On now, you're going to open your mouth. Don't force it, just do this. Okay? Now, I'm going to move down a little bit this way. I'm weighing you right there. You just relax. Perfect. So I'm weighing his head. I don't want a lot of tension. Now, I'm going to bring his head into slight rotation like this. And here's why. Because I think I'm going to need to have a little bit of rotation. That means that if the jaw is like this, we're going to have to add a hint of rotation to drive this ramus down and back to a central point. And here we go. Ready? And hold. Exactly. So I'm going to gently support his occiput, my left hand. I'm going to get here. I'm going to drop in this manner. Dylan, you ready? Okay, ready? On now. 1, 2, 3, now. Nope, we got to do it together. Ready? 1, 2, 3, now. Got it. Perfect. We were out of sync on that first one.
Yeah.
Just relax it. By the way, when you have somebody reset your jaw, never chew on anything hard like ice. Never chew on anything that's too chewy like caramel, like a well-done steak. Never take a bite of a big apple. Okay. Give that a couple days to really settle down because you've overstretched the ligaments. Okay. Now, watch this. Hold. Okay, now bite down. Hold. Here. Now hold. Okay, now let's put more stress on the system. Dylan, sir, come right up here. Spin this way. Take a moment. When you're ready, stand up. How are you feeling?
Good.
Now, let's watch his jaw. Come right over here. Thank you for this. Relax your jaw. Look at this. Look at this. Beautiful. How's that feel?
Good.
Turn your head this way, sir. There you go. Now, here we go.
Wow.
Okay, now I'm going to take a little bit of tension, Dylan, off of here. I'm going to release the jaw here. And I apologize. Good.
A lot smoother.
Yeah. Now, hold. Hold. Bite down. This arm here. Then hold. That's a little weak. Okay. Some rotational distortion here. And hold. There you go. Sit right here for me, sir. Tail of the table. And let's do this since I'm so dyslexic. Let's try both sides. And hold. Not at all. Made him weaker. This side here. And hold. Much stronger. One is, again, I can muscle test the segment. Boom. 4. Relax here. And relax. Smooth, gentle, and effortless. Give him a moment, let him process. How you doing, Dylan?
Great.
Now hold. Bite down. Walk around. Feel good?
Yeah.
Jaw feels better?
Yeah, it feels a lot looser.
Excellent.
Feels coming.
Dylan, thank you very, very much.
Thank you.
Chelsea, thank you for videotaping me.
Absolutely.
Ladies and gentlemen, enjoy my video. Catch me at Health Matters. Catch my radio show. I'm on every other Tuesday. I'll be on this Tuesday, January 8th at 5 p.m. Eastern Standard Time. Catch me on Facebook Live.